Dr. Jeremy Anderson, who's the consultant psychologist at Hammersmith Hospital for sickle cell patients, has very kindly agreed to give a talk on how to be assertive in healthcare settings to help and aid sickle cell patients when accessing healthcare pathways. So without further ado, I'll pass over to Jeremy to start it.
Great, thank you very much, Ralph. Okay, it's lovely to be here. So maybe to begin with, I'll just talk about our agenda, what I would like to cover today. So the first thing, if my presentation is going to work correctly, I just want to go over some quick ground rules for how we want to do the presentation. You know, it's not often that I do all this virtually, and I try to make these presentations interactive, so hopefully we'll get some back and forth. We'll just want to set up some rules, and then I'm going to go through some topics related to what we call assertiveness, and this is not a comprehensive treatment of the topic. Normally an assertiveness course might last for something like 10 or 12-week process. And I'm going to try to compress all of that down to an hour. But we're going to be talking about relationships and communication. We're going to talk about what assertiveness is, as well as some barriers, that is, some things that make it difficult to be assertive. And that's going to include getting feedback from other people and giving feedback. And finally, we're going to really address, I think, the meat of assertiveness, which is dealing with confrontation. Okay, so in terms of ground rules, I think these are pretty basic. Most people will understand these. So essentially, we want, you try to show some respect and courtesy to people, being polite, and that means trying not to interrupt people when they're talking. Obviously, that's a bit difficult with a virtual session because there is a bit of a delay. But certainly we'll try to interrupt as little as possible. And of course, I like to mention confidentiality. Basically, sometimes when I ask for examples, it may be tempting to talk about a particular issue that may be bothering you. But if you do that, what we want to do is make sure that everyone feels comfortable sharing things. So we don't want to give people's identifying information or something that, we're not trying to slander people here. We're just sometimes talking about some difficult topics. So I think that makes sense. Before we go any further, is there anything else I'm missing that people think we should lay down as a ground rule? Or are you happy just to move forward? I will take your silence as evidence that everything is okay.
Yep, happy to move forward.
Okay, sounds great. Okay, so first question I have for people is, I want you to think about relationships, right? And relationship is one of those words, we talk about like a partner, like a romantic relationship. That's my relationship. But relationships refer to something much more broad. And so I'm wondering, can people give me some examples of the kinds of relationships that you have? Who do you have a relationship with? And just shout them out.
Colleagues, partners.
You have a relationship with your colleague or partners. Who else?
Stakeholders, customers.
Stakeholders, yeah, in a business, if you have a customer. What about more broadly?
Society.
Yeah, right. And what is the thing that makes the relationship with other people in society?
Your connection to them, whether it's work or business or family,
exactly.
Friends.
Exactly. You have a connection to people. You have a relationship really with anyone that you share something with. If if you're driving your car, you have a relationship with other drivers because you're sharing the road. right? If you're sharing space with other patients in the bay, you have a relationship with them. You have a relationship with the people providing you care when you're in hospital. And this is a really important relationship for people with sickle cell. Having a long-term illness like sickle cell disease, it presents people with three main challenges psychologically. This has been discussed previously, but really your job is to obviously manage your symptoms. That makes sense. People need to manage the social and emotional consequences of having a long-term illness. So that means the effect on your relationships, on education or employment or occupation. And something that I work with people a lot in my role is people have to maintain an adequate relationship with healthcare providers. And I think what's unique about a long-term illness, even more so than, for people who don't have an illness but just show up to hospital because they broke their leg, is people with sickle cell, you tend to be cared for repeatedly by the same people over and over. So, when you know the same people over and over, you tend to develop a different kind of relationship. They start to feel like family, and that's not always a good thing. Sometimes we have the worst fights with our family, and the problem with bad relationships with family members is we're kind of stuck with them for the most part. So it's important to have a good relationship with, between carers and patients. Okay, so how do we have a good relationship? Well, most people would acknowledge that has something to do with communication. So what do we mean by communication? Well, communication really refers to the messages we send, that is what we're putting out there, and then how those messages or whether those messages are received. Do people actually hear what we're saying? Do they understand what we mean? How are they taking that message? And is that the same as how we meant it? You may have heard that communication is, 10% verbal and 90% nonverbal, right? So what do we mean by that? What are the other ways that we communicate to people? And again, just shout them out. How do we communicate besides talking?
Body language,
With our body language.
facial expressions.
Facial expression. Someone saying something?
500,000 people were pinged last week.
Oh, I think that was just background, but yeah, so facial expression, our personal space, the clothes we wear, the expression on our face, eye contact, whether we're displaying emotion, how fast we're walking, how straight we're standing. All of these things communicate things to other people. And so when thinking about how we're communicating, it's important to think about all the different ways that we communicate. Last thing I would say is, in terms of communicating with people, a certain amount of conflict in relationships is inevitable. And the reason for that is, you may have heard this saying, is that, each one of us are unique. There's no one in the world that is quite like you. But the implication of that, if that's true, what it means is no matter who you're talking to or who you're communicating to, at some point you're going to have a disagreement. And so a certain amount of conflict is inevitable. How do we deal with conflict, right? People have different communication styles, particularly when dealing with conflict. You can think about different styles, different ways people like to communicate in terms of a continuum, with passivity at one end, and on the other end of the spectrum is aggression, in terms of different kinds of communication styles. So assertiveness is right in the middle, right? What do you think? When I say assertive, what do you think? right?
I don't know whether it's in the middle.
No, it's not, right? So most people think, you know, assertive is sort of like aggressive light, but that's not really what it is, right? In the middle, we have something called passive aggression. It's a mixture of both passivity and aggression, and that's particularly toxic. So let's just talk about these communication styles to begin with. So if you think about passive behavior or passive communication, right? If someone is being passive, what does that look like? What do you think of when you
Non-confrontational body language.
non-confrontational, right? So this person, they're looking small, right? They're, you know, they're not, you know, they're not sort of standing up, puffing up their chest, trying to look big. They want to look small, non-threatening. They're trying not to get noticed. They're flying under the radar, right? Might be fearful, but right? What does it sound like? Well, people who are very passive, the idea is they tend not to say very much, right? If you ask them a question, yeah, they'll just agree with you because they don't want to disagree, right? Tend to be very quiet. So what do you think the goal of being passive is? You want to avoid conflict, right? You don't like confrontation. You're trying not to have conflict, okay? What about an aggressive style? What does aggression look like?
Big, loud.
Big, loud, dominate, right? These are the people who speak really loud, who get in your face. They're you know, trying to intimidate you, right? The communication is tense. And the goal of aggressive communication is to win or control, right? If you look at communication and relationships as a power struggle, you don't want to be dominated. You want to dominate. It's a win-lose situation, right? So I said the passive aggressive style is a mixture of the two, and this is particularly toxic. And the idea with passive aggression, it's a little tricky, but passive aggression, it doesn't come off as aggressive per se, but it's just kind of sneaky, underhanded, obnoxious, right? These are people who the idea is to be aggressive, but do it in a way that you can't really be called on it. And so people might, you know, an example of this would be sort of the veiled insult or a backhanded compliment, right? So an example of passive aggression, right? So if I said, you know, Alice, that's a really nice outfit you're wearing. That's much nicer than what you normally wear, right? So that's the backhanded compliment, right? So if Alice got upset with me for saying that, right? I say, well, what are you so upset about? I was trying to compliment you. Boy, stop being so sensitive, right? So the idea here is to be aggressive, but without facing the consequences of being aggressive. So none of this is assertive, right? And you know, if we think about it, like, what's the problem with these types of communication styles? What's the problem with being passive, avoiding conflict?
You don't get what
You don't get what you want. You don't get to express yourself. And you let other people control you. That's pretty frustrating. Even if you're afraid of conflict, it's pretty aggravating and dissatisfying to be passive all the time. What's the problem with aggression? That might seem obvious. people don't like you very much if you're aggressive, right? And you might think you're winning, but have you actually changed someone's mind, even if they agree with you? Not really, right? They might just be telling you what you want to hear. And of course, with passive aggression, I mean, if you're just obnoxious and insulting people, that's not very good either. None of these communication styles bring people closer together. They tend to drive them apart. If you want to have a good relationship, we need to have a communication style that transcends these other styles. Now, everyone slips into these modes from time to time, but most people would prefer to be assertive. So what does assertiveness look like? Well, if you're assertive, you're willing to be there to be seen, but you're comfortable. You're relaxed. Your body language is not tense. You're not shrinking. You're just there, right? What does it sound like? Well, you express yourself. You're honest. You're willing to voice your opinion, right? But your goal is to express yourself and be genuine. So you're also willing to listen to other people. You're not trying to control them or dominate them. And as long as you express yourself, you can't be dominated either. So you have no need to be tense. So this sounds really good. How do we do this? So the definition of assertiveness that I like is taking responsibility for our behavior and allowing other people to take responsibility for theirs. So I'm going to do my thing, and I'm not going to take responsibility for, how you feel. What makes it difficult to be assertive? Well, first off, I would just point out that nobody's born assertive. Assertiveness is not a personality trait. It's not something that you just are. It's a skill. And like any skill, it takes practice in order to get good at it. And so the first barrier to assertiveness is not knowing what to do and needing to practice those skills. Stress. Stress makes it difficult to be assertive. Does anyone know why? Why would it be difficult to be assertive when you're stressed? What do you think? What do we call the stress response?
Is it just a little bit more difficult to kind of gather your thoughts and articulate yourself? Just the distraction of whatever it is that's stressing you?
Exactly. When you're stressed, you're being distracted. Your body is directing you towards a threat. You're probably experiencing the fight or flight response. Now, what does fighting or fleeing sound like?
Passive or aggression.
Exactly, right? The fight or flight response, that's aggression and passivity. So your own body is pulling you towards two responses that you don't want to have. So when you're stressed, that makes it more difficult to be assertive, right? It's not that it's not that it's never okay to be aggressive or to be passive. It's just that most of the time, you'd like to be assertive, right? If you're walking along and someone pulls out a knife and says, "Give me all your money," well, it's better to be passive. That is not the time to assertively tell that person, "Well, actually, this is my wallet and I don't feel like giving it to you today," right? You're probably better off just responding in a passive manner, right? On the other hand, if you thought the mugger was going to kill you no matter what you do, maybe your best option is to get really aggressive. Maybe that would be the best thing. I can't tell you what the right thing to do is, but that might be the thing that saves your life. Most of the time, though, our stressors are not that kind of threat to our life. Most of our stressors are social. We have a fight with our boss or our spouse, or we get admitted to hospital and we're having conflict with the nurses or the doctors that are looking after us. And these are really social stressors. And so most of these stressors are not helped by either, punching someone in the nose or running away. Culture can make it difficult to be assertive. Maybe you come from a culture that doesn't value assertiveness, right? Or maybe with certain kinds of relationships, it's more difficult to be assertive in a certain culture compared to others, right? If we think about how cultures differ, say in the way, parents and children interact, right? Is it possible for kids to be assertive with their parents? That might differ. Gender can make it more difficult to be assertive. And this might actually interact with culture. Maybe in some cultures, we expect, say, men to be assertive or men to be aggressive and women to be passive, right? Keep in mind, though, that even some of the messages we get from the culture don't actually fit in real life. So, for example, where I come from in North America, if you ask people what they would do when they get angry, this is what I did for my PhD study, was we asked people the kind of response that they thought that they should engage in, that they would do. And they expressed that they would openly express their anger. They'd be aggressive because that's what their culture tells them they ought to do. But the reality is, most of the time when people have an encounter that makes them angry, they're not able to express their anger. They don't do it, and it wouldn't make any sense. If you get cut off on the freeway while you're driving and you're incredibly angry, do you follow that person home and give them a piece of your mind? No, of course not. That would be open expression that might be encouraged, but most people don't do that. The other issue is power. In any relationship, it can be harder or easier to be assertive depending on the power dynamics involved. It's easier to be assertive with your spouse, maybe, than it is with your boss. For the patients in the audience, do you find it difficult to be assertive in hospital? And if so, what do you think makes it difficult to be assertive when you're in hospital? Or if any clinicians in the audience, what do you think? Why might a patient find it difficult to be assertive with you?
I'm neither of those things.
Okay.
Neither a patient or a clinician, but
Okay.
the people that I represent, the kinds of comments that they will make is that they find it difficult to question clinicians in the hospital because they feel that they are in a position of knowing, and so if they say that's how it should be done or how it should not be done, then they'll just accept that even though they feel uncomfortable about it. So that's one thing, the kind of you're the expert, I'm not kind of thing is happening for them. And also that they just quite often so grateful that they've finally got an appointment or they're finally sitting in front of someone that should be able to help them, that again they just anything you say, I'll do that because it took me so long to get here, and so those are the kinds of comments that I hear.
Yeah, exactly. So there's two issues there. One is the role, right? It's the clinician's role to be the expert and the patient to be the recipient. But also there's a power issue there, right? The clinician is the one who has the thing that the patient wants. And maybe the patient's had to wait a long time for this. It's hard to get what you want, and the patient doesn't want to risk that, right? So that can make it difficult to express yourself if you think it might, impact your ability to get what you need because you're in the lower position. So that's really important to keep in mind. So let's talk a little bit about how we might go about being assertive in terms of getting feedback, right? So I'm not going to cover sort of receiving compliments. Some people find that difficult. But for those of you who can see the screen, in terms of what you can see there, can everyone see a tiny little dot? It might be too small to see, okay? So I'm going to try something. I've never tried this virtually before, but I think it would be fun. So what I want everyone to do, so I want you to take your index finger, hold it up in the air. Okay, everyone holding it up in the air. Now I want you to close your eyes, and without looking, I want you to touch the little dot on the screen. Sorry about the fingerprint on your screen. Okay, everyone close your eyes, go. Put your finger on the screen where you think the dot might be, right? And when you put your finger on the screen, open your eyes, okay? Now, I won't ask everyone, but I didn't hit the dot, okay? And most people don't hit the dot on the screen, okay? Is anyone wanting to brag? Did you hit the dot first time? No? Okay. If I asked you to do that with your eyes open, of course, all of you would hit the dot every time, right? Why? Why did you miss the dot with your eyes closed, but you would hit the dot? I missed that, sorry.
Because you can't see.
Right? Because you can't see, right? When you work towards hitting that dot, right, with your eyes open, the information coming in through your eyeballs is giving you feedback. It's telling you what you're doing right and what you're doing wrong, right? You need that in order to hit the target, right? To accomplish what you want. If you're doing it wrong, you need to know. Right? So what's worse? All of us would like to be right all the time. But what's worse, to be wrong and receive correction, or to be wrong and not know it? I think it's worse to be wrong and not know it, right? Because you're further away from being right. That's something to consider when receiving feedback. Even if the feedback is not delivered in a particularly constructive way, you might actually need that feedback. Anyway, what many people find especially difficult is giving feedback. And so it helps to actually have a script or a series of principles that you want to cover, a template for how to give feedback or how to make requests of someone. And so we're going to go through that. And I think I sent Ralph a handout that includes this script that you might use to make requests or prepare in advance, as well as some other tips. So in terms of giving feedback, we talk about something called the DESO script. DESO, the D in DESO stands for describe. You want to describe the situation, right? And the important thing with the description is you're just listing the facts, and you're trying to keep it short and sweet. So in this example, unfortunately, I vomited after taking the anti-sickness tablets, right? That's the situation. The E stands for express. You want to express how has this situation affected you, right? What's been the impact? Well, because you vomited your anti-sickness tablets, you remain nauseous, and you can't keep anything down long enough to stop feeling nauseous. So the tablets are not helping. S stands for specify, right? You're making clear what you want. I would like an injectable anti-sickness formulation, please. An outcome. This is where you talk about what will happen if the person, does what you're asking them to do, right? In this case, if they give you an anti-sickness formulation that actually works, well, and you're not vomiting, well, you'll be able to drink water and keep it down. So having them help you is actually in their interest, because the doctors and nurses, they want you to hydrate. Any questions about that? No? Okay. So let's practice. That was my example with the anti-sickness. Here's an example of a desoscript blank. So you describe the situation, express the impact, you're very clear about what you want, and you think about the outcome, right? Does anyone feel courageous enough you want to work through an example for the group, right? What would be an issue where you might want to make a request or give some feedback? You want to tell someone something you would like them to do or you would like them to not do. Doesn't have to be the most difficult thing in the world. Doesn't have to be in hospital. It could be in any area of your life. Anyone got one?
Sorry, can you just elaborate? What kind of example do you want us to give?
Just something where you would like to give someone feedback, make a request. You're asking them to do something or to not do something.
Okay. Okay, the kind of example I was going to give was the kind of example probably is a bit different to maybe what you're asking specifically. It's in regards to my workplace. Like, for instance, my manager wanted to give me an example in terms of areas where I could improve in my performance and not to go about improving it because I was working from home. And most of my appointments seems to be on a Zoom. And he's just trying to obviously give me feedback how to build more rapport with my client and how to improve in terms of my performance. But the things I find is the way he presented the feedback is not very, how do I put it? It's not very helpful because he was giving me the feedback in a way that it seemed like he's putting me down.
Yes.
I did get his point on what he's trying to obviously make me aware and how to obviously improve my performance in terms of how I'll build my rapport with my customers and stuff like that.
Okay.
And I did get it, gist, but the way he gave me the feedback didn't come across very nice. Well, that being said, for him, I find it very offensive in the sense that he was giving me that feedback like that, despite I'm the highest and the top performance among my colleagues. I would have expected him to give that kind of a feedback to my other colleagues that are underperforming or that are performing averagely. And I took it quite very, very not properly. And instead of,
Sorry, that's a great example. Okay, so sometimes you might give some feedback to other people about the way they give you feedback, right? So there's lots of pitfalls and ways that people can give feedback or do things that are upsetting. So for example, let's maybe not just to put you on the spot too much, but let's imagine you're in a situation where your boss is giving you feedback, but let's say they criticize you in front of your coworkers, right? And, you know, whether or not the criticism is valid, it's embarrassing for you to be criticized in front of your coworkers, and you want them to stop, right? So that might be a situation where you would use a deso script to try to be more assertive and essentially ask your boss to give you that feedback in a different way, right? So let's all brainstorm. If you were going to come up with a description of the situation, what would be a single, like, one sentence, concise description of what's happening? What might you say? Maybe I'll start. Okay. So you want to describe the situation. So you might start by saying something like, you know, I noticed the other day that you gave me some feedback, you know, in front of, you know, the junior colleagues, right? It's just factual. You're just saying this is what happened, right? And so they've criticized you in front of your colleagues. What's the impact on you been? How did you feel?
It could undermine how you work with your colleagues in future. They might kind of be a little bit more dismissive if there's something they think you don't do well.
Yeah. And how does that make you feel? To be a total psychologist here.
Knock your confidence, make you feel, question whether you are as good as you think you are.
Exactly, right? So if you were to say something to express the impact, you could say, you know, I feel undermined and it's affecting my confidence, right? So what is it you want your boss to do in future?
Maybe next time it would be good if we could speak in private.
Yeah, right? You could say, you know, I'm happy to get feedback from you, but in future, I'd like that to be a private conversation, right? And what would the outcome be?
I think it would give the opportunity for the manager and that member of staff to have some better communication, because maybe the manager was literally ignorant in the real sense of the word and didn't realize what they were doing. Sometimes people just don't realize. So maybe it's a learning curve for that manager as well, and they might be mindful of doing that with other people too.
Yeah,
so
right.
It might lead to better one-to-ones with your manager where you feel a little bit that's been successful. So in future, if your manager's saying or doing things that you're uncomfortable about, it might make you feel a little bit more emboldened to say, actually, I know you asked me to do it this way, but you know, I don't think that works. I'd like to try it another way. And so it might just open up, sort of improve that relationship between the manager and that member of staff.
Yeah. So if they can keep the feedback, you know, the criticism private, right, then it will improve your relationship with your manager, right? So, you know, the deso script would be, you know, hey there, you know, when you gave me the feedback the other day, I noticed you did that in front of my colleagues, right? That left me undermined, and I'm, you know, it's affecting my ability to do my job. You know, next time, could we do that in private? And that'll help us get along a bit better, right? So these don't have to be super long scripts, and you know, they don't actually have to be in exactly that order. But as you get more comfortable with these, even if they feel awkward at first, you can customize them, customize the order, and the more you do it, the more comfortable you'll get at it. So that's a good tool for giving feedback. Did anyone have any questions about that? Does that make sense? Yeah. Okay. Okay, here we are getting to the the most difficult thing, the meat of the discussion here. And that is confrontation, right? Remember, in every relationship, conflict is inevitable, right? Some amount of conflict. Sometimes real open conflict can indicate a serious problem in the relationship, like if there's violence in the relationship. But other times, the problem isn't that there's conflict itself, it's just the way we're handling the conflict. Okay, so why is it so hard to confront people? Well, oftentimes a conflict, something where you would have to literally confront someone, it's a complex situation. It's not as simple as a one-off event. Maybe there's a whole pattern. And it can be difficult, so you need all of your assertiveness skills all at once. It's important. These are usually more emotional, more stressful, right? So stress is pulling you away from being assertive, right? It may take a lot of time, right? Now, you can do some preparation with the DESO script beforehand, but the other person's probably going to have a response, and you're going to need to respond to that response. And usually you have to do that on your feet. You can't always prepare everything in advance. There are some things you can do, and we'll go over that. But this makes confrontation challenging for most people. Most people aren't that good at confrontation. It takes practice. So here are it's a fairly lengthy list of tips to help with confrontation. So the first thing is probably pick your battles. You probably don't need to confront everybody about everything you don't like in your life. So I think it's important to ask yourself, how important is it really? Do I need to confront this person? And the other issue is, if I'm confronting this person about a thing, is it really this other person's thing? Can they change? Is the situation to blame? So, for example, in the hospital, what I hear all the time is, the doctors want to limit my painkillers. And that's often because they're facing enormous pressure to not have an opioid crisis in this country the way there is in the US, right? The pressure isn't coming from them. It's coming from someone else, right? Are they really in a position to change? Maybe not. Obviously, this probably isn't an issue with the hospital, but certainly in relationships, if you're dealing with someone who could be violent, you want to make sure that you're safe, right? Do you want to do this alone, or do you want to have someone there with you for backup? You want to choose the time and the place. Make a plan for how you will have the confrontation. You want to pick a time so that you won't feel rushed. You want to invite the other person to the conversation at a time that they're not rushed, right? Although, again, like I said above, you might want to be in a public place to ensure safety, make sure other people are around. But for very sensitive conversations, you probably want to have some privacy. So even if you decide to have a confrontation, I don't know, in a restaurant or something, if you're talking, to your ex-spouse about child support, you probably don't want to be in earshot of everyone in the restaurant, right? You want enough people around, but also have the other person feel like there's some privacy. Right? Doing something very public can be kind of a passive-aggressive approach of just trying to embarrass or humiliate someone, so you don't want to do that. The next tip, you want to spend some time before the confrontation describing the problem to yourself. And this is important. This isn't the DESO script per se. This is really just giving some thought to exactly what the issue is. Oftentimes when we feel like we want to confront someone, we're not really sure why. We just have a vague sense that we're just emotionally unhappy. I'm really angry at what's going on here. But we need to think about not just our feelings, but the behavior. What is it the other person is doing that is upsetting us? And why are we upset with what they're doing? It may be that the other person is in the wrong, but again, maybe the issue isn't the other person. Maybe the problem is with us. And so maybe it's not appropriate to confront. Maybe we're the one who needs to change. It's important to think about that before initiating your confrontation. Other tips, you want to make sure you know what success would look like. And this often involves thinking about what you're really hoping to gain out of the confrontation. Most of us have a secret goal or a fantasy when we're confronting someone. We want the other person to admit they're entirely wrong and we were entirely right. That's not going to happen. I don't think that's ever happened in the history of the universe. So you probably need to let go of that as a goal. Next tip, you want to write a desoscript, right? So you're giving feedback to the other person. And in addition, you think, what are they likely to respond with? So you give your desoscript. How are they likely to respond? You can't be certain exactly how they'll respond. And maybe there's a few different options, but you could imagine the different responses and then write another desoscript or something similar to how you would respond to their response. It's not exactly how the conversation will go in the moment, and I'm not saying you need to bring cue cards with you to read off your script, but it helps to just sort these things out in your own head beforehand. Okay, confrontation is stressful, so you want to relax. If you can practice relaxation, even just some deep breathing, there's lots of different kinds. I teach diaphragmatic breathing. There's something popular with Navy SEALs called box breathing. There's 7-11 breathing, all sorts of really just getting you to breathe slowly and deeply will tamp down your stress response and make it easier to be assertive. You want to keep an eye on what we talked about before, your body language, right? Your tone of voice. If you sound accusatory, if you're aggressively staring at people, if you're invading personal space, that's going to be interpreted as aggressive, right? Again, if you're having a confrontation, but if you're being too passive in your body language, that's not going to work well either. So you want to work on feeling, relaxed. You're expressing yourself, but you're also willing to listen. It also helps to start with bonding. I think we've all heard that it's helpful to, start off a criticism by finding something positive. And it doesn't always work well. It can be done very awkwardly, right? Like if I say, to go back to Alice, Alice, that's a really nice outfit you've got on. But this thing you did the other day really upset me, right? That's a horrible segue, right? Really, when you're trying to bond, when you're trying to say something positive in the context of a criticism, what you're really trying to do is frame the complaint, right? So when people know that you're upset about something, they don't know what the bounds are. And people can sometimes react as if the problem is really much bigger than it is. It's much more stressful for them. They know you're upset with them. Do you hate everything about them? No, right? There's some things you do like, but there's just certain things that they're doing that you want them to change. So you want to by bonding, you make clear that your criticism, what you're confronting them about is on a specific issue. So you want to use your desoscript. The other tip is when you're talking about these things, when you're using your DESA script, take ownership. That is, these are your thoughts and your feelings. Try to avoid the issue of, you're doing all these things and everybody agrees with me, right? Everybody thinks so. It doesn't matter if everybody thinks so or not, right? Even if nobody but you thinks so, you still might want to confront people, but it's not about a consensus. It's about you. So make that clear. The other issue, sort of like giving up secret goals, is stop trying to win. If you give someone feedback, if you confront them on something, if they change their behavior in the way you want them to, even if they don't admit they were wrong, that's probably good enough. You've gotten what you want. And so it probably doesn't matter that they're not groveling before you on their knees. "13 is pretty obvious. Stay on point, right? If you talk about things that happened in 1972, we're going to get sidetracked. That's not relevant to what we're talking about now. Absolutely no absolutes, right? So this is the idea of avoiding words, absolute words like always or never. Right? You never do this, you always do that. Why would that be a problem, do you think? Even if the person does always do something or never, or it seems like that.
It's a bit of an extreme, isn't it?
Yeah.
It's absolutely an extreme. And you just invite the person to come up with the single counterexample of when the always or the never isn't true, right? If you say, you always bring my medication late, well, no, I can remember back in 1982, I gave it to you on time. So you're wrong, right? So now you're arguing about whether always or never is the correct word, but that's not the point. The point is right now, they're bringing your medication late and you want that to stop. Active listening. Again, there's a whole session on this that we would normally give, but the idea with active listening is you're trying, when you're listening to someone, most people are thinking about what their retort will be. They're not actually listening to what the person is saying. When you actively listen, you're really focused on what the other person is saying, and the only thing you're thinking about responding with is repeating back to the person what they've said in a way that they would agree with. And this is important, right? So if you say to someone, look, you've been delivering the medication late and that's causing me more pain. If the person responds back to you and says, what, so you just want loads of opioids now? You want to just use painkillers forever? Is that what you're saying? Well, that person's they're not repeating back to you in a way you can agree with, right? That's not active listening. What you actually want to do is repeat what they've said in a way they would agree with. If you can do that, the other person will feel listened to and they'll get less defensive. Getting to the end here, you want to emphasize where you agree, right? A point of agreement, this is the start of something productive, right? So if you can say, in this case, for example, so it sounds like we agree that the goal is for me to get out of hospital as quickly as possible, right? We just have a different idea of how to reach the goal, right? So we're allied in what the goal is. We're just talking a different language in terms of how to do it. If the other person makes a good point during the confrontation, acknowledge that, right? Most of the time, we don't want to admit that someone ever has any good points. We feel like it's showing weakness or we're losing the argument. But really, someone will take your criticism much more seriously if they believe you're honest and can acknowledge when there's something good. And so if they make a good point, just let them know. This is really important. When you confront someone, they're not always going to respond well. They might say something that is really stupid or really insulting or really ignorant. No matter what you do, do not retaliate. If you retaliate, give people the ammunition they need to completely go off the rails, right? Has anyone ever had the experience of, I don't know, talking to someone, customer service, right? And the whole thing is incredibly annoying and frustrating, right? And that person is just waiting for you to use a 4-letter word with them so they can do what?
Disengage.
They can disengage, right? I don't have to listen to you swear at me, sir, so I'm going to hang up now, right? That doesn't work out well for you, right? Even if the person was horribly obnoxious, the moment you retaliate, it's not going to go well. Sometimes you're going to get angry, right? It's normal. You're stressed, but you'll be more productive if you can remain calm. But that doesn't mean that you want to ignore the anger feelings. And so it's fair to talk about the anger, right? When you say that, I feel angry, right? That's okay. You can say that calmly, non-threateningly, rather than showing how angry you are by, yelling or punching the wall or something. And lastly, this is a bit tricky. Get comfortable with silences, right? When you're in a confrontation, people are talking about serious things. They may need to think. And it's normal for people to pause and not respond right away if they're thinking very carefully about what they want to say. That's okay. The other issue is that sometimes people use silence if they know that you're uncomfortable, right? If you're giving a confrontation, they just don't say anything. They're waiting for you to jump in, back down, because you can't handle the silence. So if you confront someone and they're giving you the silent treatment, that's okay. Just sit with it. Be very cool as a cucumber, right? Feeling comfortable with the silence, and wait for them to respond. Anyway. So those are my 20 tips for a confrontation. I would just add that after a confrontation, reward yourself or compliment yourself, right? Notice that confrontation can be difficult, right? And even if it didn't go perfectly, feel good about the effort. You're learning a skill and you're getting better at it over time. Lastly, monitor what happened, right? So when doctors and nurses give someone a blood transfusion, they don't just pump blood into you and walk away, right? They want to know what happened, right? They give you a blood test. They want to see what happened to your hemoglobin. Are you having an allergic reaction? Are you hemolyzing? Is it actually improving your pain or the frequency of crises? They want to know, is the intervention working? In the same way, a confrontation is an intervention. You're trying to change something, in this case, another person's behavior. And you want to know, did it work? What didn't work, right? And also, what do you need to do now, right? So if part of the confrontation, was, they give you the anti-sickness medication and you'll be able to drink more water. Well, if they agreed to give you the anti-sickness, now it's time for you to drink some water, right? You need to hold up your end of the bargain. Anyway, that's it for my presentation. I think we're just about out of time, but does anyone have any questions?
Can I just say, I don't have any question per se, but more to say that the bit on Deso, I think that was really fantastic. Really fantastic for me as someone who has sickle cell, and sometimes one comes into the hospital and it's almost as if you have to be in a combative mode. I'm sorry to use that kind of expression, but yeah, I think I need to look through that again. I took some screen grabs. I don't know if you're able to send us copies of that.
Yes, yes, we can. That's actually that's the main thing. I think I sent Ralph a handout, so I think he can distribute to the group. It's got the Deso script as well as all the tips for confrontation. So I wouldn't recommend people jump into a confrontation using the Deso script just yet. You want to start off small, and as you get better at it and more comfortable with the script, then you want to try gradually more difficult things over time.
Yes, yes. And I think for me, it's to start with that, not go in thinking, okay, confront, but think, okay, what can I do to kind of lessen the situation, even though it's hard, because when you're in pain, your mind and your whole psyche is about the pain. But I think, now that one is in a relaxed mode, it's really good to be able to do that.
Exactly.
So I'd like to say thank you very much for taking the time to bring about this presentation this evening. I heard of it very last minute from my community nurse. So I didn't even hear about it from Hammersmith that I go to, but I'm glad that I was able to join.
Oh, thank you. Anyone else?
Thank you. I, again, not a question really. It almost feels as though we want to set up like role plays for people to actually get some practice in doing some of this, because I think that it can be so. It's a different way to approach the hospital and appointments, and I think to get their head around it, it's almost as though they need some practice to prepare, because we do some advocacy, so we do attend appointments with some of our members, but it almost feels as though I want to kind of set up some role plays with them and kind of get them ready and sort of make them think about what questions do you want to ask, and if I behave this way, how will you respond, but still try to get the outcome that you want. So it's given me some food for thought, definitely. Thank you.
I think I mentioned at the start, I mean, normally an assertiveness course would be, once or twice a week for 10 or 12 weeks. And so we go over these concepts in detail, in much more detail than I have tonight. And, the nice thing is that, on the session with Deso scripts or confrontation and stuff, like we talk about the Deso script, and then everybody writes a Deso script, and you do role playing and you practice, and it would be really nice to be able to do something like that in a group. Once all this COVID restrictions are ending, and we can, I suppose we can do some of it, online, but breaking off with a partner, doing something, and then presenting that to the group is incredibly helpful, because not only do you get to work on it with one person, but people get to see what it looks like, and you get feedback, and those people get to practice giving feedback. And so, it's really helpful.
I think that'll be really good when COVID is over, because as Sonia says, I tend to come to hospital by myself. And every time I say to myself, when I'm sick, I really do need someone else with me to help me express myself. Not that I can't express myself, as you can see now, but when I'm sick, I probably can't as well as I would want to. And I'm probably quite frustrated with what's going on. And sometimes I just think people who live with sickle cell should have somebody else come with them to the hospital. So maybe having this assertiveness workshop with role plays might help. Yes.
Yeah, I'd be happy to set something like that up. Anyone else? Okay. Well, thank you very much for listening. And, you know, if anyone has any further questions or things you want to work on, feel free to contact me. I'm happy to help out with this.
Perfect. Thank you so much,
Thank you very much.
I'll make sure there's a script around to everyone after the meeting.
Okay.
Thanks, everyone. Bye.
Okay. Thank you. Bye-bye now.
Bye. Thank you.
Thank you. Bye.
Thank you. Bye-bye.
Bye.